Hello and welcome. Today, we're diving into a condition that affects the ear, not the eye, called auricular hematoma, also known as cauliflower ear. While seemingly cosmetic, understanding its cause, effects, and treatment is crucial for preventing long-term complications. Join us as we explore this interesting condition. So, what causes this unique deformity? Auricular hematoma most commonly results from blunt trauma to the ear. Think sports injuries, especially in contact sports like wrestling, boxing, and mixed martial arts. But it can also occur from other forms of trauma, such as car accidents, falls, or even repeated minor injuries that add up over time. Basically, any event that damages the blood vessels in the ear's cartilage can potentially lead to a hematoma. Let's talk about the how behind cauliflower ear. The auricle, or outer ear, is primarily made of cartilage, which relies on the perichondrium, a layer of tissue tightly adhered to it, for its blood supply. When trauma occurs, blood vessels in the perichondrium can rupture, causing blood to accumulate between the perichondrium and the cartilage. This blood clot separates the perichondrium from the cartilage, effectively cutting off the cartilage's nutrient supply. Without adequate blood flow, the cartilage can die and eventually scar, leading to the characteristic thickened, deformed appearance we know as cauliflower ear. Auricular hematomas are most prevalent in individuals who participate in contact sports. Wrestlers and boxers are particularly susceptible due to the repetitive and forceful impacts their ears endure. While specific epidemiological data on auricular hematomas can be limited, it's generally accepted that the incidence is directly related to participation in high-risk activities. Furthermore, inadequate protective measures, like headgear or timely treatment of initial injuries, can increase the likelihood of developing this condition. Identifying an auricular hematoma is usually straightforward. Initially, you'll notice swelling and redness on the outer ear. This swelling is often tender and may feel fluctuant, meaning it feels like it contains fluid. Over time, if left untreated, the hematoma can harden and become more firm. The skin overlying the hematoma may also appear bruised or discolored. In severe cases, the hematoma can be quite large and cause significant pain and disfigurement. Diagnosing an auricular hematoma is typically based on a physical examination. A healthcare professional will assess the ear for swelling, tenderness, and the presence of a fluid collection. In most cases, imaging studies are not required. However, if there is suspicion of underlying fractures or other injuries, an X-ray or CT scan may be performed to rule out more serious problems. While auricular hematomas don't have distinct classifications or types in the way some other medical conditions do, the severity can vary greatly. A small hematoma might present as a mild swelling, while a large one can cause significant disfigurement and pain. The chronicity also plays a role. An acute hematoma is a recent injury, while a chronic one is one that has been present for a longer period and may already be undergoing scarring. The primary goal of treatment is to drain the accumulated blood and prevent further cartilage damage. This usually involves draining the hematoma with a needle or small incision, followed by applying a compressive dressing to prevent the blood from reaccumulating. Antibiotics may be prescribed to prevent infection. In some cases, surgery may be necessary to remove large or chronic hematomas or to correct significant deformities. Timely and appropriate treatment is crucial to minimize the risk of developing cauliflower ear. Prevention is key, especially for athletes. Wearing appropriate protective headgear, such as wrestling headgear or boxing headgear, can significantly reduce the risk of auricular hematomas. Prompt treatment of any ear injuries is also essential. Even seemingly minor bumps or bruises should be evaluated by a healthcare professional to ensure that a hematoma does not develop. Education about the risks of auricular hematomas and the importance of protective measures is also crucial for coaches, athletes, and parents. The prognosis for auricular hematomas is generally good with prompt and appropriate treatment. However, if left untreated, the cartilage damage can become permanent, resulting in cauliflower ear. Recent research is focusing on improving methods for draining hematomas and preventing recurrence. Techniques such as fibrin glue injection or specialized compression dressings are being investigated to optimize outcomes and minimize the risk of long-term deformity. While cauliflower ear is a visible reminder of past injuries, understanding its management and prevention allows us to minimize its impact. Thanks for watching.